webinar, 10 days after the Secretary General published a policy brief on the implications of COVID-19 on the rights of older persons, on older persons in general, and yesterday, 140 member states, the missions in New York, they co-signed a statement of support of this policy brief of the Secretary General. So we are very happy to be able to do this with you. And before we start with the two keynote speakers, I want to give the floor for some opening remarks to Ambassador Milenko Skoknic from Chile. Thank you, Ambassador. Unmute yourself.
Thank you. Thank you very much, Sylvia. And good morning to everyone there in Geneva or New York or wherever you are. We're here at the breakfast time in New York. And firstly, I would like to thank warmly the NGO Committee on Aging in Geneva for the invitation to participate at this event. It's the first time that both group of friends of older persons in New York and Geneva are collaborating together in such an important activity. So thank you very much also to the High Commissioner for Human Rights, President Michelle Bachelet, for being with us today, and a special greetings to Claudia Mahler, you know, the independent expert on enjoyment of all human rights for older persons. Thank you very much for being with us as well. And I also would like to say hello to Rosa Kornfeld-Mate for her valuable work and contribution. As you mentioned, the Secretary General launched the policy brief, the impact of COVID-19 on older persons, and also it's good to know that we had 140 co-sponsor of this statement, so here in New York. So it has been a great work, and I think it's very relevant that the Secretary General for the first time refers exclusively to the older persons in this type of document. And of course, we support this initiative. The brief of the Secretary General provides analysis and recommendations to address the challenges older people across the world are facing these days, and higher fatality rates, risk of poverty, discrimination, and isolation. And so the public discourses that focus on fatalities more than on infections portrayed COVID-19 as a disease of older people, leading to social stigma, discrimination, and negative stereotypes about older persons. But this reality emphasized the urgency to recognize that greater attention needs to be paid to the specific challenges faced by older persons in this health crisis, and the need to plan and implement a response that is informed, that is inclusive, and targeted. A successful response to COVID-19 must recognize and equally address such concerns. So society should address existing deep-seated inequalities and age discrimination and advocate for older persons' autonomy, independence, and a stronger protection of access to social services, including social protections. In my country, in Chile, we had, of course, designed programs to mitigate the most complex obstacles that older people face. And these have to do especially with the loss of autonomy and independence. And through the government body, the SENAMA, with the support of the First Lady, we have launched several initiatives to protect older persons during this pandemic. First, the Major Protection Plan that includes a set of measures to reinforce the care for adults over 80 years of age who must remain at home as a protection measure. Also, support to residents and nursing houses to take preventive measures, providing protection equipment for workers, support and replacement personnel in case of contagion. And also to fund some of these needs through the SENAMA, we have reallocated $10 million in order to cover approximately 228 residents in the country. Faced with this reality, our main objective in this matter has been to promote an active vision of aging, trying to turn that period of life into a positive period. And this approach is based on the recognition of human rights of older people and on the principles of independence, participation, dignity, assistance, and fulfillment of their own wishes presented, of course, in the document Principles in Favor of Older Persons, approved by the General Assembly. Today, with the pandemic, our national effort must be greater, looking for adequate answers to the specific problems of older persons. To conclude, let me say that we believe that a successful response to COVID-19 with a human rights approach for older persons can be achieved through our shared efforts, consider the opinion and the necessities of the older people. The international community must work together to ensure the well-being of older persons, the fully empowerment, as well as the promotion and protection of their human rights. Finally, we would like to highlight the valuable efforts by civil society in improving the situation of older persons worldwide, and to reiterate, the group of Friends of Older Persons here in New York will continue to work tirelessly to promote the rights of older persons around the world. And I thank you very much for this opportunity that you have provided us, and thank you for the initiative, and it's very timely. Thank you.
Thank you, Ambassador. And of course, we join you in also thanking Rosita Confelmate, who leave us, but she will carry on working with us, as always, promoting the rights of older persons. And as we work together with her, we will work with Claudia as well. And just before I give the floor to Michelle Bachelet, some comments. For some reason, we are not linking to the Facebook Live. So we are recording this event, and we will post it afterwards in Facebook and on our YouTube channel. And if you have questions, please feel free to send either to the Q's and A's that you will see, or in the chat. And we will do our best to answer all the questions that you are asking. What we don't have time for, we will make sure that somehow we will respond during the coming time. And now we move to the, our keynote speakers. And I have an open question to both of you. How can we promote the rights of older persons in these challenging times? Madam High Commissioner, the floor is yours.
Well, thank you very much. Ambassador Milenko Skoknic and Ambassador Sabina Stadler, chairs of the group of Friends of Older Persons in New York and Geneva. Dear Sylvia, chair of the NGO Committee on Aging in Geneva. Excellencies, colleagues. I'm really pleased to join you in this timely and crucial discussion with respect to the human rights of older people. And I really want to thank Sylvia, the NGO Committee on Aging, for organizing it. And let me warmly welcome now officially Ms. Claudia Mahler as she begins her mandate as the new independent expert on the enjoyment of all human rights by older people, and also like to pay tribute to her predecessor, Ms. Rosa Confermate, for her outstanding work over the last 6 years. Dear friends, the COVID-19 pandemic continues to challenge our societies, our communities, and ourselves with dire and potentially long-lasting consequences. And my office has been actively monitoring the human rights impact of the crisis across the world and working with partners to integrate human rights in the UN humanitarian and socio-economic responses. All of us are going through unsettling times, but the virus is posing a particular severe threat to the lives and health of older people. We usually use this concept that the virus does not discriminate, but the impacts do, and they disproportionately affect some communities, some people. And of course, older people are among those who are more vulnerable and that usually are being left behind. So we need also in the response to ensure that we don't left behind anyone. Of course, it was mentioned that usually people think about the fatality rate, but indeed the fatality rate for older people is higher overall. And for those over 80, it is 5 times the global average. So let us be clear, every life has equal value, and our rights do not diminish with age. And we need to ensure that difficult medical decisions are guided by a commitment to dignity and to the right to health, and based on medical need, ethical criteria, and on the best available scientific evidence rather than on age alone, because we have heard allegations of decisions that are made of inaction sometimes because of age. Less visible, but no less worrisome, are the broader effects of this crisis. Healthcare denied for conditions unrelated to COVID-19, neglect and abuse in institutions and care facilities, an increase on poverty and unemployment, the dramatic impact on well-being and mental health due to physical distancing and social isolation, and the trauma of stigma and discrimination. I'm particularly concerned about the situation of older people in care homes and institutions. In Europe, according to the WHO, up to half of total deaths have been among those living in long-term care facilities. Older people who are quarantined with family members or caregivers may face higher risk of violence, abuse, and neglect. Older women may also be highly vulnerable since they're often family and community caregivers. Those living in precarious conditions such as refugee camps, informal settlements, and prisons are particularly at risk. But even though older people have been gravely affected by the pandemic, the response to it has often failed to adequately take their rights into account. On the 1st of May, as has been mentioned, the Secretary General issued a policy brief to give more visibility to the risk faced by older people during COVID-19, the pandemics, as well as recommendations, clear recommendations to address these challenges. The policy brief also highlights the unmeasurable contributions they make to their families and communities in various roles, including caregivers, volunteers, or community leaders. And fundamentally, it asks us to rethink the way forward, to recover better together across society, but also across generations. So colleagues and friends, this week, while many countries are still struggling with the pandemic, others have started to ease restrictions and develop roadmaps towards recovery. While the future is uncertain, one thing is clear: when we recover, we must be better than when we were before. We cannot go back to where the day zero. We need to solve the inequalities that the pandemic has shown, the people who have been left behind. We need to include the needs and concerns of older people in the response, but also in the recovery afterwards. This crisis has taught us that a society can only be as strong as its weakest member. We have the opportunity to build more inclusive, sustainable, and age-friendly societies. For that, we must place human rights of older people front and center in our responses and our recovery efforts. This crisis had laid bare and often amplified many challenges that older people have been facing for years, such as discrimination based on older age, lack of social protection and access to health services, lack of autonomy and participation in decision-making, and risk of violence, neglect, and abuse. So we need to invest more in ensuring economic and social rights, particularly in universal health coverage and universal social protection system, to improve the well-being and resilience of all, including older people. But we must also shift our mindset and challenge the ageist view of older people as frail, dependent, and vulnerable. The older population is an incredibly diverse group, and we have a tremendous potential to contribute to the recovery efforts. We need to ensure that the voices, perspective, and expertise of older people are incorporated in the policy making, particularly where they will be the most affected. So they need their voices to be clear, and they need to reflect it in the decision that countries are making. Last but definitely not least, we're all in this together, so we all must be accountable for our actions or inactions. Many countries lack adequate legislation to protect the rights of older people and to prevent discrimination, exclusion, marginalization, violence, and abuse. And there is no international convention dedicated to the human rights. We needed to build a stronger legal framework at both national and international levels with a strong accountability mechanism to protect the human rights of older people. The Secretary General has made a call to accelerate the efforts towards developing an international legal convention dedicated to the protection of the human rights of older people, and we must urgently press on. I look forward to working with you to stand up for the human rights of older people, raise their voices, and ensure their meaningful participation in the COVID response and beyond. Thank you very much.
Thank you so much to you, Madam High Commissioner, and very strong words, and we support what you're saying, and thank you for bringing to the fore the need for a legal framework to support the rights and to bridge the gaps on the human rights and the protection of human rights. And now I will go straight to Claudia Mahler, but let me say simply a few words for those who don't know her. Many of us know her and have known her because she has been working on the human rights for older persons for many years. And she has been working for the German Institute for Human Rights as a senior researcher in the field of economic, social, and cultural rights since 2010. And she has specialized in the issue of human rights of older people. I'm not going to spend more time in introducing all the other things that you do, like you're also a professor, but I will invite everybody to go to the website of the independent expert where everything appears there. So Claudia, I give the floor to you before we go to questions.
Thank you so much. Madam High Commissioner, Ambassador Milenko Skoknic, Ambassador Sabina Stadler Repnik, Excellency, dear colleagues and friends around the globe. I'm really honored to begin my mandate with this wonderful event. And I would like to thank the organizers, especially the chair of the NGO Committee on Aging, our host Sylvia Perel-Levin, and everybody else who made this event happen. This also gives us the opportunity to meet in these strange and fretful times. I want to particularly thank the High Commissioner for her wonderful and inspirational speech. You clearly showed the magnitude of challenges we must deal with to strengthen the human rights of older persons. I was under your leadership, as a matter of fact, that Chile ratified the Inter-American Convention on the Human Rights of Older Persons, which is the example we look at in our endeavors to better protect older persons. I also take this opportunity to thank my predecessor, Rosita Rosa Confeld-Matte, for her exceptional work to fulfill the new mandate and lay a basis for us. In discharging my mandate, I will do my utmost to continue working with states, civil society actors, international and regional organizations, and the UN system, national human rights institutions, and older persons themselves, towards enhancing the promotion and protection of the enjoyment of all human rights by older persons. In that regard, I look forward to hear from you what you consider the most important issues the mandate should deal with in the next 3 years. We all had to learn through the pandemic in a drastic way that action is urgent. This is why my first report to the General Assembly will focus on COVID-19 and the human rights of older persons. The pandemic had an impact on everybody around the world. It had a tremendous impact on older persons, for their daily occupation, in the labor market, for their social inclusion, for their freedom of movement, for their right to life and access to healthcare, and in many different other ways. The examples of impact and risks are as diverse as is the group of older persons. Heterogeneity of the age group cannot merely be defined through a single age limit. It is a social construct based on custom, practice, and the perception of the role a person plays in the community. The pandemic has drastically amplified existing ageism that results also from portraying older persons as a burden for society. We have to rethink our images of older persons once again. There is an acute need for additional or more granular data to develop evidence-based policies that are inclusive of older persons. Such data will render older persons and their immense contributions and unique role visible and reflect their immense diversity. As governments start to consider how to find a way to recovery from COVID-19, we have to be careful to find inclusive paths. Older persons therefore need to be consulted and have to participate in the considerations on how to find our way forward. As the High Commissioner already said, we need to change our ways. We need preventive approaches to ensure the non-recurrency of the most serious human rights violations against older persons. The international legal regime pertaining to the human rights of older persons is currently scattered, uneven, and incomplete. The new Secretary General's policy brief on the impact of COVID-19 on older persons clearly calls to strengthen the legal framework in this respect, This reaffirms the conclusion and the recommendations made by my predecessor in her seminal 2016 report, comprehensive report. In my opinion, a convention would make a big difference and be a paradigm shift. I trust that working together as a global community, we will ensure for older persons the strongest protection of their rights in the future. Thank you.
Thank you very much. I can comment that we have a lot of comments and questions pouring in. So we will try to do the best we can to address as many as we can. I think that we can cluster some because there are several that we have already received in the last couple of days and some that they are coming through now that they relate to similar issues. One issue that comes back are issues of data. How can we get appropriate data? Other issues are how to balance the lockdown with the call for participation of older persons. Other issues that are coming through is the ambivalence and of some governments even signing the statement in support, but in fact promoting ageism in the society. So how can we balance what goes on in governments? And while we prepare this, I also would like to ask a specific question that came in the last couple, that comes from your talks. Madam High Commissioner, you mentioned that the office is actively monitoring the human rights impacts of COVID-19. Could you give some examples of how your office is responding to the crisis at country level with regard to the human rights of older persons, and maybe link to what I just said about the ambivalence with some governments? Thank you.
Thank you, Sylvia. Yes, well, yes, I can give some examples. Even though, as you know, many of the things we're doing it from remote because we are also concerned about the safety of our colleagues. But for example, several field presence, particularly in the European region, are monitoring the situation of older people with a special attention of those in care facilities. In Belgium, for example, OHCHR has closely monitored the situation of care facilities and identified several issues of concern, such as absence of systematic testing, shortage of staff, and fragmentation of government responses. In Ukraine, our office has interviewed 30 people working in care facilities throughout Ukraine and has raised concern about the shortage of equipment, lack of access to medical care for non-COVID health issues, and stigmatization of health workers. In Moldova, to mention another example, our office has created a task force on NGOs on COVID-19 and human rights in monitoring and providing support to older people. But we have also identified good practices, because I think one of the things we're trying to do in all this is identify possible, potential, sometimes even unintended consequences of human rights, of needed health measures and emergency measures, but also to try to collect good practices, because that can be an inspiration for other countries. For example, the Regional Office for Europe in Brussels has looked at the ethical recommendations issued by the Belgian Medical Academy on Intensive Care Unit, patient prioritization, which specifically noted that age alone could not be a criteria, and a decision for non-referral should be taken by a group of less of 3 specialist doctors. Similarly, regional offices in other regions have been collecting several good practices by governments and civil society. But we also have been actively engaged in the UN socio-economic responses at country level, and to integrate human rights in UN country teams' effort to support governments and partners in addressing the pandemic. For example, our regional office for East Africa in Addis Ababa has contributed to the development of the UN socio-economic impact analysis in Djibouti, Ethiopia, and Tanzania, using a human rights-based approach and emphasis on marginalized groups, including, of course, older persons. Or our office for Central Asia in Bishkek co-chairs the protection sector group, which carry out the human rights monitoring of COVID-19 with a focus as well as marginalized group and its protection sector plan of action includes specific actions to the protection of older people. In Serbia, following the advice of the human rights team, the UN resident coordinator has reached out to the state ombudsman and the Minister of Social Affairs to advocate for increased action and focus on the right of older people and other groups at risk. And every time that I've been participating in many virtual meetings, I'm sure all my colleagues the same, we always speak about this, that the impacts do affect disproportionately certain groups, and that countries need to have specific policies that will be able to really respond to the needs of the older people. And sometimes when you have this intersectionality of older people that can be refugees or IDPs or migrants or women, I mean, you see that sometimes being older people, in many places they are left behind. But when you have all this intersectionality, it's even worse. And so the UN on one hand, the UN country teams need to look at all, and of course if they're in prison, another issue, then care facilities. So we need to look at all of this situation, the complex situation, and try to find the best possible responses that member states can give, and also with the support of NGOs that have been very actively in many places, but that we have also seen that because of the COVID response, many countries are diverting resources, taking out resources from NGOs and civil society to use it for another kind of responses. So that is also something that we are really concerned about, to think on how we protect human rights defenders, but also civil society, because we do believe they're fundamental. But one of the problems, I believe, for participation, because you asked how you do this, is that the digital divide sometimes for older people is very complicated. And in the briefing of the Secretary General, it says that in the United Kingdom, 4.2 million people 65 and older have never used internet, for example. So there are also certain difficulties that will make more difficult the participation. But for example, in some places that we are providing NGOs with cell phones because they don't have technology and other kind of situations. So that is complicated in countries that are developing countries that have less technology and less money. But we need to find ways on how we ensure the participation of older people in the response and in the design of the response, and also, of course, in the design of the recovery, because the socioeconomic impacts of this COVID-19 will be devastating. And we need that in that recovery, older people are also included.
Thank you so much. Maybe Claudia would like to add something, but I may add some spin to the question as well, because both of you have mentioned, and the ambassador, and I mentioned as well, the need of a convention. So what is stopping us? How can we progress towards implementing or signing or drafting a convention on the rights of older persons? Claudia, can you give us an idea?
Yeah, that's a very good and very important question from my point of view. I think what we really need is to bring this consideration of a convention, or just the idea of a convention, to the national level, because right now this is a discussion which only takes place in the United Nations and not very much on the national level. So therefore I would say one of the first steps which needs to be that we have discussions on the national level. This is also a task for NGOs, NHRIs, and maybe also for UN agencies on the basis. So come together, bring together the governments, because what we also have seen is that not many capitals are in New York. So it would be good to bring some of the capitals with their knowledge, how it really works on the national level, to the United Nations UN office, so we can discuss in the open-ended working group this on a more specific level, which is also true and interesting for the national level. So we have really to combine this, and to also to think a little bit about how we can get this promoted. I think many of the older persons which should be covered from a new convention don't have the knowledge that we are talking about this and what kind of added value this would have for their lives. So I think in this respect, we also need to inform them much better, and also make them visible in these conversations and let them participate also in this conversation as well. I think this is also related to the question you also asked, why do we have these different perspectives? So on the one hand, states promote the rights of older persons, and on the national level, it's not seen, it's not visible. I think this has also to do that we deal in this regard with different parts of government, and sometimes the immense impact of the human rights is not visible for them on the national level. So therefore, I still think we do have a kind of awareness raising, or we need the kind of awareness raising program to show exactly that human rights have an added value also for the national level. You also asked the lockdown and the participation, and thank you, Madam High Commissioner, you already mentioned the digital world. And I think one step further, we also need to inform the people properly, because many of them don't get the information in a way which is easy to understand. So therefore, I would also promote the right for information. So we need to further this in a way as well. Thank you.
Thank you. And I know that Madam High Commissioner.
May I add something?
Of course.
Well, of course, I mean, I think Claudia mentioned the most important things, but, and we don't know when the open-ended working group will be able to resume, and I hope when they resume, they include all the stakeholders in that discussion. And of course, I completely agree with Claudia that the national level is essential, and that they haven't been that participated, but I would like to say that we could, in the meantime, we should also focus our effort on making more effective use of existing human rights mechanisms and opportunities to integrate older persons in other processes, for example, such as national SDG reporting. Or I don't know if you feel that in the UPR report it's already really taken in the details and in the relevance that it should have, because that also helps the national process when you have it in all this sort of accountable mechanism that can be used to promote the right. On the lockdown, yes, I think it's true also that there are some rights that we accept restrictions because we know that is for a major cause like a natural disaster, a health cost, but it should be only for a certain time, no? I mean, like freedom of mobility or freedom of assembly, but there's no excuse to restrict freedom of expression, freedom of press, arbitrarily detention, etc., etc. So, and we are concerned because in some parties have been misused, if I may say, the concept to, you know, to restrict the human rights defenders and journalists and so on. And finally, on data, how we can get more appropriate data. Well, I remember when I sat down with the group of experts of Afro-descendant, they told me if they don't count us, we don't count. And I'm probably with older people as well. And I think something that we need to work much more is with the National Institute of Statistics to ensure that is something we have been working with some countries like Kenya, for example, or others, to see if with the National Human Rights Institution and National Human Rights Statistics, to see if we are really counting and identifying who are left behind. Because otherwise, if we are able to recover the Agenda 2030, then unfortunately I feel many countries will divert money from that to the COVID response, but we have a decade, so we can continue working on that. We need to know exactly who we're leaving behind. So we need to work with them. So in all the statistics, we can really have better data that can really identify what goes with the older people, what happened with older people and their situation. And that's something we have been working with some countries, and I think it's an area where we could do much better.
Thank you so much. And I know that you will have to leave soon, so you feel free to leave, and Peggy will answer if you are not here with us, and we appreciate so much your time. But I want to add on something like that, what you said about the data, and we all know that we need to be counted to count. And UNFPA is sending a message saying that they also released a technical brief that many of us have seen, and they emphasize the development of quick population mappings based on recent census data to identify the number of older persons, where they are and in which socioeconomic condition they live, in order to ensure more targeted and effective response to crisis. The question is how we can ensure the development of clear criteria and parameters for the systematic collection of older persons' data. And one of the points that both mentioned is the importance of knowledge at the national level, also towards the convention, and also in order to know what the rights are and how to use the existing international human rights mechanisms, because many people don't know how to access them, how to use them. So one question that has come from several NGOs sending questions are, is OHCHR preparing a specific guidance on COVID-19 and the rights of older persons? We know that the briefing, the SG brief, is very much human rights based, but maybe do we need a specific guidance that focuses on older persons and that can help the national level prepare better and understand the system? To you both.
Silvia, I will have to leave, but I don't know if Peggy is already here, because in the policy briefing, all the policy briefings that the Secretary General has issued in all the areas, we have been providing them with a lot of inputs, recommendations, and so on. But maybe Peggy can make more comments on this. Sorry, but I'm sorry, I have another engagement.
Thank you very much, Vinyu.
Bye-bye.
Again, and thank you so much for your time. Maybe Peggy.
Shall I jump in then, Sylvia?
Yes, please do.
Very good. Thank you all. I won't go through all the big thank yous, but we're so happy to be able to participate in this.
I didn't only say Peggy, I just didn't say what your position is. So maybe you would introduce yourself to those who don't know you.
So I'm fortunate to work with the High Commissioner and head up the division that handles the broad range of thematic issues and the special procedures. So I'm happy to have the chance now to work with Claudia and with Rosa before her. And of course, we've been engaged on the issue of the rights of older persons. And in fact, we're working with my colleague Rio Hada and Khalid Hassan and Denise Hauser in New York, all contributed to the Secretary General's policy brief on this issue. Thank you for the question on where we go next. We wanted, of course, to have that statement from the Secretary General as really the leading edge of this discussion. What we've done in general is back up those statements by trying to collect good practices around the specific recommendations. So the report itself contains some specific recommendations that we think should be put in place with regards to protection of the rights of older persons in the COVID-19 context. And what we're now doing is looking at what have states done to respond to those recommendations. So we hope to have what really is a more augmented type of guidance that doesn't repeat what's in the report, but really tries to look at the way some of these issues are playing out in practice in the field. And that's the work that's going on now. I would also mention that we also don't want to duplicate some of the guidance that's been done specifically relating to human rights and health issues in institutional settings. There's been a lot of conversation, rightfully so, on this call about the situation in residential care homes. And it's something that we feel very strongly needs to be taken up much more substantively by countries. And I noticed there was a question on the chat as well about what are some specific recommendations in that front. The High Commissioner has already touched on many of them, but I would just emphasize that this is the type of question we really hope states are asking in the context of releasing lockdowns. That the issue should not just be what's good for the majority, but also what do we need to put in place to protect those who will be most potentially at risk when lockdowns are released. And so really looking at having in place testing capacity, better monitoring capacity. And I noticed, of course, someone else in the chat commented on simply the lack of resources in some of those institutions to be able to do all of this. So those are the types of things we'd really like to see governments focusing on now as we may be moving in some places into the next phase in confronting the pandemic. Thanks.
Thank you, Peggy. And Claudia, there are also questions or comments that when we talk about disaggregated data, also there is the question from Alex Kalache from Brazil. That there have been several questions from Brazil regarding the situation of the indigenous people and how the age cut that we generate, the cutoff that we use in Europe or in North America or in other places of the world, does not apply to indigenous people where they feel, or they are old when they are 40. So, so can we include ethnicity, race, or what other parameters should we include when we collect data?
Thank you, Sylvia. I think maybe I should also go back to what I already said, because I think the heterogeneity of the age group can really not be defined through a single age limit. So I think this is quite clear for us, and I think this is also quite clear for everybody else, but it makes it quite hard to give a definition who is an older person, especially as we just have heard about the questions. It really is a diverse system, because it is a social construction. It's based on practice, perception, and also the role of a person which it plays in the community. I would also say that it makes a big difference in what kind of economic system you're working and how good you're off. So your social economic status is quite a constructive indicator to show exactly what it means. And also the High Commissioner already said that the interrelatedness and the intersectionality is key to get better insight in the data. And I think it's quite hard to get this. I have to say I'm a lawyer, so I'm not quite good in statistics, but I'm sure we all together find a couple of indicators which makes it much easier. And it was already mentioned, the SDGs, but I think the older persons are not very much related to the SDGs till today. So maybe this would also be good to have more indicators when we are dealing with the SDGs to integrate older persons and their diversity in there as well.
Could I come back in on that point too, Sylvia, just quickly? On the data disaggregation point, you know, one of the things that we've talked about as well, and this was a big conversation around the Secretary General's brief, was the need for more stratified data that would, you know, reflect not just older or not, but actually is specific to, you know, every 5 years groupings of age and collection of data along those sides, which I think is really important. But, you know, I do think there was a question on the chat as well about sort of the flip side of this, where age is used as the single criteria for various actions. So you'll see in the paper, there's also discussion, and the High Commissioner raised this in her remarks, about triage being based solely on age and some of the problems that can come up with that. And of course, the brief is very clear that medical decisions need to be based on evidence and on a full set of criteria that look at the full range of issues around any individual and not solely based on age or disability. And so to answer the question that was raised in the chat, where someone asked, you know, how would we look from a human rights perspective on a lockdown that says that certain people of a certain age should continue to stay at home while others are allowed to go out? It's that sort of singular analysis that we think can be problematic, because of the multiplicity of issues wrapped into age, as Claudia has described. You know, we have to look at that intersectionality and be willing to say that it may be perfectly safe for some older persons to go out, but it may not be safe for others, and there has to be a much more nuanced approach to any sort of limitations that would bring in factors like age into any stay-at-home decisions, in our view. Thank you.
There are many comments as well that also came in by email, and that we see on the news, the enormous impact on residential homes, on care homes, on institutions, and people asking what exactly are the human rights violations that are happening in those care homes. And I would like to link it with another question from Bridget Sleep, which I think from HelpAge International, which I think is very important. It says the rights of older people, which have been significantly overlooked today, have come into sharp relief during this pandemic, and a lot because of issues of care or lack of it, or access to services. And how can we ensure that they do not fall off of the political and other leaders' radar once this pandemic has passed, once the peak has passed? How we can carry on focusing on the much needed human rights of older people beyond COVID-19? Claudia and or Peggy.
Okay, thank you. I think this is always the question, you know, we are human and we like and try to forget, but still you are right. We have to have a focus on this and what happened and not to forget this. And the care homes and the access to the services showed quite clearly that older persons, especially in institutions, are left behind because they are already living in an institution and somebody takes care of them. And so not the whole community has to think about this once again. But I think we also got some very good examples where they showed that it is possible also to isolate people in an institution and give them the health care they need or the treatment they need. But we also had very bad examples where we have seen that the older persons living in these care homes were left alone, and only the carers and the people taking care of them were taken to the hospital and treated correctly. And so people were left behind and really had to live there without access to services, without service of their special needs. So every single human rights you can think of was violated in this regard. It was the right to life, it was the access to health service, it was access to an adequate standard of living, which includes nutrition, food, and really the basic stuff in this regard. So how can we raise awareness to this? I think we need to show these very bad examples to raise awareness that we really have seen human rights violations in this regard in Europe, in really rich countries as well. So we haven't been prepared. So we need to have preventive mechanisms in this regard. And I think we all have to work together, as the Secretary General and the High Commissioner already said. We have to work together in this regard and really think about preventive mechanisms to make this not happen again. Thank you.
Thank you, Claudia. And also, of course, we also have comments telling us the importance of contextualizing the socioeconomic factors and the care issues as well to the geographical and cultural environments. However, I like also to ask Peggy, how can we challenge all the ageist comments being said on the media and by sometimes even the governments? Talking about older persons as in an objectified way. Can you comment to that?
Great, thank you very much, Sylvia. On the point about the homes, I want to emphasize two things. One is that, you know, one of the things that we saw is that by limiting visitors, it has a twofold impact, right? First of all, it of course contributes to the isolation and the mental and psychological stress on the residents of the homes. But secondly, visitors and outsiders are a very important monitoring tool. And so we really have to take that into account, that there may be reasons for not allowing people in, but if that's the case, then we need to find another way to make sure that people who are in homes have the ability to reach out. We talked about the digital dimension, but also that there is a different way to make sure that abuse and neglect are not occurring through having better monitoring. And please, we need to support the staff that are there as well. You know, there were staff obviously who could have done more, but many of them were left in completely unworkable situations as well without protective gear for themselves. So, so we need to protect them at the same time. But the second point I wanted to make, and one that emphasizes that difference between different environments, is that while those horrible things have been happening in these institutions, the reality is so many older persons are cared for at home, and in many settings don't have access even to that type of residential care. And they tend to be cared for at home by older unpaid women who have that double burden then of caring for older people in the home, but themselves potentially being at risk. So we always have to look at that broader long-term care issue and the gap on that side as well in addressing these questions. You asked very much about the ageist framework for this and how do we respond. I think, and I'm known for always trying to find the glass half full, the optimist view of this, but it's really an opportunity for us people have been more explicit about some things that are often sort of lingering under the surface in ways that issues are addressed. And it gives us a really important opportunity to really call this out and to talk about how much it hurts, how much it is harmful to people for us to think in the ways that have been put into the public domain. But secondly, how bad it is for all of us. You know, when we lose out on the expertise and ability and the contribution that older people are making in our societies by somehow pigeonholing them into, you know, these categories. So I do think it's an important opportunity. We need to be very explicit about it. I always think we might be helped a bit by the fact that many of the influential people in the world are older persons and are in a position to speak out about this in an authoritative way. I know that the High Commissioner and I heard the Secretary General say, I'm an older person, this matters, and I'm speaking to you as an older person. And to talk about that and to see the capable older people who are engaging in many ways to protect the rights of the world, not just the rights of older persons, is important as well. So I think we need to be very explicit about the ageism and discrimination and confront it head on. Thank you.
Thank you, Peggy. Now, before I give you back the floor, Claudia, for your last word, I will give you the last word or requests or questions to ask. I want to give the floor to Ambassador Sabina Stadler-Repnik from Slovenia, who has been very patiently waiting. And we want to, I don't know if you want to wrap up some of the things that were said, or what is your message to us?
Well, thank you very much. A lot's been said, and I can just say that I believe that the current pandemic has been an enormous shock to all of us. And what this shock actually did was that it revealed many, many issues and trends that were kind of pre-existing situations, but now they came to the surface and we have to face them. So if we look at the available data on impact of COVID-19 on the older persons, very worrying trends have been revealed. And to be sincere, they are not new, and the current crisis has just brought them to the light and revealed, for example, the very high existing levels of discrimination, exclusion, marginalization, even violence and abuse, and that this is something that actually older persons feel and experience all around the globe, and in some very sad cases on a daily basis. And as a permanent representative of Slovenia, which is a country truly committed to the promotion of rights of women and gender equality, I would really like to echo the words of High Commissioner, stressing the multiple and intersecting discrimination against women, especially older women. I think that this is a category of people that all these issues that we discuss and mention today are really, really exacerbated. And when we talk about all these challenges that the older persons need to face on a daily basis, they're really very real challenges, and they're there to stay unless we really decide and act on them. And I really believe that it's vital to pursue the joint quests for promotion, protection, fulfillment of rights of older persons in all UN fora that it's at our disposal. And how to do that, that's the question that we always ask ourselves, especially diplomats trying to be helpful and to put into the whole debate some added value. We, of course, strongly support the efforts of the General Assembly's working group to develop proposals for an international legal instrument to promote and protect the rights and dignity of older persons, like both main speakers also underlined. But we deem that a stronger engagement at the Human Rights Council is also very important. And moreover, we believe in a better interagency coordination that goes beyond a couple of annual meetings, but really to try to address the issue in a more kind of a intersectional manner. Of course, nothing can be achieved without a strong support of member states and each and every one of us. So we really count on the member states and of course also the broader community like NGOs and other stakeholders. Of course, also from my side, big thank you to you, the Committee of Aging, our non-governmental member of our group of friends here in Geneva, for organizing this event. I would also like to express my deep appreciation and gratitude to both main speakers, to Madam High Commissioner, and to our new independent expert for rights of older persons. Thank you also to Peggy to jump in, and to my fellow ambassador of Chile, Milenko Skoknic in New York. At the same time, of course, this is an opportunity also to thank all the participants in this virtual debate. As the Ambassador Skoknic already mentioned, this is the very first time that we organize something like this in co-sponsorship of active member states in New York and in Geneva. Maybe just the last thought. This crisis causes a lot of uncertainty around the globe, and it reveals, but it also reveals some new opportunities for moving forward in solidarity, with compassion, and I'm hopeful that this is something we can use as an impetus and create a momentum for moving rights of older people more to the forefront of the human rights conversations. And when I mention conversations, I would really like to say that I strongly believe it's not enough to talk about older persons. It's very important that we include them and we discuss with them. So we should stop seeing older persons as kind of a burden, but we should rather integrate them as partners to contribute jointly to our societies. I thank you.
Thank you so much. And I would like to say that I don't wait for being given the floor, I take it. So, and I hope that many other people will follow us as well, as they are doing, in fact, at the moment. Now, Claudia, I will ask you to say the last word, and I want to apologize to many of the attendees. Really, we had at some point 350 here with us, and that we could not answer in 1 hour all the questions. And I would like to ask you, Claudia, will it be okay that we have another conversation, maybe in the format of meeting, so we can have more interactive session that people can talk to you directly, as long as we cannot meet in Geneva. And of course, we will try to address these questions as well in writing, but I'm sure that this will not be the last meeting. So I'm warning you, and I'm pleased I say the last words, and goodbye to everybody.
Okay, thank you, Sylvia. Thank you so much. Thank you, everybody, also for contributing so much. I didn't have the chance to read all the reactions in the chat, but I will do it afterwards because I think we are saving it. And sure, I'm really looking forward to have more conversations with all of you. And I read a couple of chats, and some said, how can older people or older persons be more active in the discussions? And I would like to say it once again, please stand up, get to your national level or your regional level and start a discussion. Start a discussion as an NGO, start a discussion as, you know, as an older person, which is already a paradigm shift, because when I started working in the field, everybody said nobody wants to be an older person, so nobody wants to be part of this group and wants to be seen as an older person. So if we already have this shift here, it might be much easier for us to discuss content and get older persons included as the best practitioners, and as, you know, you are much better in knowing what you want than us. So we really want to once again say what Mrs. Ambassador Stadler Repnik said: we don't want to talk with you and have our conversation with you, not about you. So thank you so much. I'm really looking forward for your inputs for the mandate, and I'm sure it's not our last talk.
Exactly. Thank you so much. And I also wanted to say this is not the end. This is the beginning of a conversation that I hope we can have often, and that it will move into action at the national and regional and global level. Thank you so much for all of you. Thank you so much for the co-sponsors. Thank you so much for the attendees, and goodbye.